Very unusual, this, isn't it? As we normally only see sporadic travel-related cases. What do you make of it?
Well, we have actually seen an outbreak in this country in the past, in about, I think it was 2018, where a small outbreak with a travel-related case who then passed the infection on to a healthcare worker. It is an infection that has been increasing globally for a few years now, and typically the outbreaks in the West have generally been associated with animal contact, but this is indeed the first time that we've seen such a large outbreak across multiple countries where there has been person-to-person transmission outside of Africa.
And are we any closer to knowing why that's the case?
I think I think there are some fairly good ideas. I think it does seem to be spreading in amongst certain networks of people rather than more in the general population, although there is probably some wider spread. It is, I think there's a lot of work being done at the moment to actually nail this down, and hopefully we will have a better idea in about a week or two.
Oh, so quite soon. I mean, that would be very useful, won't it?
Yeah, I mean, it's a question of actually tracking down all the cases, looking at where they've been, who they've been in contact with, and then trying to draw these networks together to come up with a conclusion about how it's spread. I think it's been likely that it's spread, imported with one or more people from West Africa who have then had close contact with other people back home when they're in Europe, and that's probably how it's been spreading.
And the good news so far seems to be that cases in the UK appear to be pretty mild.
Yeah, in general, in adults, it is usually a pretty mild infection that gets better on its own, typically within about 3 weeks. Although sometimes you do get left with scarring, which remains with you. But it can be severe, particularly in children and also in people who are immunosuppressed, and probably also in pregnant women.
Yeah, we keep seeing those rather gruesome pictures, don't we, of the blisters and the scarring that you mentioned. Will people be offered the smallpox vaccine, do you think? I'm thinking about people like healthcare workers or those who may have come into contact with someone who's carrying it.
Well, it already is being offered to contacts, as far as I can tell. This is what we did in 2018 with the last cluster of cases. The approach generally is known as ring vaccination. So rather than vaccinating a wide group of people, at least initially, you identify cases, you get cases diagnosed, and then very carefully identify their contacts and offer vaccine to them. One of the advantages here is that the vaccine is actually effective even if you give it after somebody has had contact, up to 4 days after contact. So what really matters and how this epidemic will be brought under control is diagnosing cases early and then careful and rapid follow-up of contacts.
And of course, following COVID, we've all become rather fascinated in zoonotic diseases, those that are passed from animals to humans. And this is an area of a great deal of research.
Yeah, I mean, it is an animal acquired infection primarily. Probably rodents, and I think the best evidence is for African squirrels as the source of this, but I don't think that is proven beyond all shadow of a doubt at the moment. But
and just finally, Paul, a pretty straightforward question: what should somebody do if they feel or fear that they may have it?
If they believe they've been in contact with the case, or if they've developed the rash, and it's a rash that looks a little bit like chickenpox, but unlike chickenpox, it tends to affect the face and the hands and the legs, and they should really go probably to the local genitourinary medicine clinic, which you can attend GUM clinics without appointment in this country, or if that's not possible, contact your GP.
OK, straightforward advice. Always good to speak to you. Professor Paul Hunter, Professor in Medicine, Norwich School of Medicine, all part of UEA. Thank you very much.